Good afternoon, students. All of you, please take your seats. We'll be waiting for Dean Madam to come. It may take another 5 to 10 minutes. So wait for the 5 to 10 minutes. Okay. So before we start, I thought of discussing with you something very important for you. How many of you know all pharmacists? All of you, silence, please. How many of you know about nuclear pharmacy? How many of you know about nuclear pharmacy? Does anybody know about nuclear pharmacy? You know? Anybody? Do you know about nuclear pharmacy? Yes, Kritika? You know about nuclear pharmacy? Put it on. M.Pharm students, do you know about nuclear pharmacy? You are M.Pharm pharmacology. Do you know about nuclear pharmacy? Nuclear pharmacy. As scientist, Nityasri, Induja, you know about nuclear pharmacy? Sandra, nuclear pharmacy. Only Vijay. Hari, where is Hari? Do you know about nuclear pharmacy? Maddie, nuclear pharmacy. Do you know nuclear pharmacy? Hasan, do you know about nuclear pharmacy? Anybody here not here? Nuclear pharmacy. Praveen, most studious student of the college. Praveen, most studious. So you know about nuclear pharmacy. Nuclear for all outgoing students, for seniors, for final year students, and M.Pharm students. Nuclear pharmacy is one new emerging area. Nuclear pharmacy is one new emerging area, especially in all specialty areas and diagnostics. That means wherever they are treating cancer patients, wherever they are doing PET scan, CT scan, okay, PET scan, CT scan, positron, proton, all cancer, wherever they are doing diagnostics, in new areas it was called as nuclear pharmacy. Okay. In nuclear pharmacy, the salaries are 75,000 per one pharmacist. How much? 75,000. Is a new area. All dynamites, third year dynamites, all third year dynamites. Third year dynamites, right? All third year dynamites, you will nuclear pharmacy. My dear students, so this is one more area of opportunity when you are scanning for crops. Also apply for nuclear pharmacist. Nuclear pharmacist. It's a new area of opportunity where they are appointing nuclear pharmacists for every diagnostic center. But salary will be very good salary. Okay. Yes, go through about nuclear, what is nuclear pharmacy also. Mageshwari, Mageshwari. Do you know about nuclear pharmacy? Praveen, Praveen, scientist Praveen. Do you know nuclear pharmacy? I'll tell you a story. There was one diagnosis for all the pharmacists. There was a diagnosis by a doctor. His name is Dr. C. N. Manjunath. A doctor, a leading cardiologist of Karnataka, Dr. C. N. Manjunath. Okay, he is a cardiologist. He is a cardiologist. What he has written is that normally, after writing the medication everything, we talk about diet, exercise. Okay? He has written in the prescription. This prescription, he has written in the prescription. Nature's 5 best tips. Nature's 5 best tips. Number 1, get adequate sunlight. The first tip is get adequate sunlight as part of protocol treatment. He has written to the patient. Nature's 5 tips. Get enough sunlight. Number 1. Number 2, he has written diet. Number 3, he has written rest. Number 4, he has written exercise. And number 5 is written smile. See, his diagnosis was of writing the drugs he has written.
Good afternoon, my all. So, every great learning experience begins with a great teacher. So, next, our beloved, our favorite teacher, Dr. Mr. G. Ramachandran Reddy, sir, research scholar, associate professor of Faculty of Pharmacy, SPMCH campus, Vaigar. Is our next distinguished speaker. He has a marketing industry experience of 20 years, both India and abroad. He was a production chemist for a year and he was also a chief pharmacist for 2 years. Now he is in academics that is adding further to his camp. So let us welcome our speaker, Chandra Reddy, sir. Take part in the class.
Good afternoon, dear students. It's lunch time. Post lunch is a big challenge. Post lunch is a very, very big challenge. Always throughout my life, I have been given only challenges. So today's topic, what I am covering, is very relevant to you, very relevant to all the burgeoning pharmacists. Very relevant. This topic is very relevant to all the burgeoning pharmacists who are doing pharmacy course and who are going out from this college. So this is one of the most prestigious lecture actually. I am very proud to do this lecture because it will touch each one of you. It will touch each one of your heart because you are a pharmacist. Before I could start, I am a proud pharmacist. I mean, proud pharmacist of the industry where I have never compromised, and only thing is that I was always happy and proud of being a pharmacist. So therefore, today's current session is I am touching on the topic called as current and future prospects of pharmacy profession. All of you can understand. I will touch on the topic called as current and future prospects of pharmacists. All of you know, as pharmacists, we have been at the pill counters. We have been at the pill counters. How many of you know pill counters? How many of you know pill? P-A-L, pill. Pill means tablets, right? Yes. Thank you. Kirtika, thank you. So, pill means tablets. So, we have been called as pill pharmacists. So, we are going from pill counters to patient counselors. We are going from pill pharmacists to patient counselors. We are going from dispenser. Earlier in olden days, we were see, we are all called as millennials. You are all called as, my age group is called as millennials. You are called as Gen Z. The family first year are called as Gen Alpha. So the progression from my age, millennial age to Gen Z, from Gen Z to Gen Alpha, the progression has come from, that is, pill counters to patient counselors, and from dispenser during our millennial age of mine, from dispenser to ultimately to Gen Alpha today, we are healthcare providers. This is the paradigm shift from millennial age, from millennials to the Gen Alpha, currently in progress. I am giving this presentation an element of, I have taken into consideration the latest National Education Policy changes of 2020 and also the pharmacy practice regulations for pharmacy students of 2015. I have taken both BPharm, MPharm, DPharm, BPharm, MPharm and pharmacy students as per the current scenario what is happening in the industry. As you can see this India map, each state has got throughout the country. We have got 15 lakh registered pharmacists. How many? 15 lakh plus registered pharmacists in this country. So this is the pharmacy today. That means as of today, the pharmacists today snapshot, take a snapshot of the pharmacists. The number of pharmacists who are registered with Pharmacy Council of India are 15 lakh plus. Number one. Number two, there are 3,000 plus DPharm, BPharm, MPharm and Pharmacy colleges across the country. You can see the split in the map, how many colleges are present in each state. So here, when you take about 3,000 plus colleges, average you take 30 students per college. Coming out for BPharm will be about 45 to 50 students, for Pharmacy will be about 30 students will be coming out. If you take average of BPharm, MPharm, Pharmacy all together, it will come about 30 to 35 students per year will be coming out. So you count 35 students into 3,000. Okay, so the number of students will be coming out will be almost about 95,000 plus students will be coming out of the college every year. How many? Excuse me. So every year, 1 lakh students will be coming out. How many students? 1 lakh students will be coming out. So remember the intensity of the competition. The jobs are only 10%. Jobs are only 10%. Proportionally, the number of jobs are not increasing. That is the current scenario. Population is increasing. The medical facilities, the government of India spends only, that is below 2% of expenditure for medical, which is very, very low if you take the standards of many countries. Okay. So in that way, as per pharmacy practice guidelines of Regulation of 2050, they were legally defined. Before that, it was not legally defined. They were define what is the role of D farm, what is the role of B farm, what is the role of M farm, and what is the role of farm D, which are clinically they have divided services. That is clinically defined, legally defined clinical roles and services. And one more amendment also they have brought. One more amendment was national accreditation of, that is especially Bureau of Hospital, Board of Hospitals. They also brought one more amendment to the current situation is that above any hospital which is more than 100 bed, more than 100 bed, they have to appoint a complete department called as clinical pharmacy services. Any hospital more than 100 bed, they have to open a department called as clinical pharmacy services department or pharmacy department. That means where they employ the DPharms, they employ the DPharms as pharmacy technicians, DPharms, that is diploma in pharmacy as pharmacy technicians, BPharm as pharmacists, and PharmD and MPharm as they are called as pharmacovigilance or clinical pharmacy services. So that way they have clearly defined the responsibilities. So that way, example for that, after that amendment only, Apollo has started full-fledged. Apollo also after 2015, big hospitals, above 100 bed hospitals, like major corporate hospitals, they have started or initiated departments in Apollo, in Vedanta, in big hospitals, in not only in Chennai also, Chennai Apollo, everywhere, all Apollo groups, Enter Apollo group, Vedanta hospitals. In Chennai also, big hospitals like Kaveri Hospital, other hospitals also, they have started many department called as clinical pharmacy services department. So this is about what we are doing, especially major clinical pharmacy services. Even they opened a ward pharmacy. Ward pharmacy was not accessible because they had only one pharmacy. For entire hospital only one pharmacy was there. But now for the main pharmacy, even they have got a specific role of appointing a ward pharmacist for every ward. That is so many bed, for example, 50 bed, one ward pharmacy. Whether they are appointed, the pharmacist also on rotation. That is what will happen to us. What is the benefit we are going to get is that the number of jobs as pharmacists is going to increase in hospital sector for those who want to become pharmacists. Okay, next slide please. Apart from being pharmacists, the other jobs to what ward pharmacist, there will be one ward pharmacist, one clinical pharmacist. Ward pharmacist will dispense the medicine, clinical pharmacist will go for the rounds and he will do about TDM. That is TDM. What do you mean by TDM? That is therapeutic drug monitoring. And also they will do medication chart review. All these things will be done in the ward pharmacy. Okay, by the clinical pharmacy services department. So when you take the current growth areas in India, when you take the current growth areas, number one, there are various sectors. That is hospital sector. Hospital sectors you will see, especially in major corporate hospitals as well as in major metros or in A1 cities or B1 cities. When you take community pharmacies mostly they are confined to rural areas, that is interiors. Confined to interiors. Okay, that is about community pharmacy. And industry. Industry is a very big word. There are special economic zones, especially in Chennai, Tamil Nadu also special economic zones are there. In different states have got different economic zones. In this particular special pharmaceutical economic zones, what they do? They try to manufacture the bulk drugs, they try to manufacture the goods, manufacturing goods. All these things will happen there. Not only drugs, bulk drugs, not only drugs to the finished product. Now new departments which are emerging are biomedical, surgical consumables, surgical non-consumables. Earlier we used to import all these from abroad. Today almost 90% of our import is reduced thanks to COVID. Thanks to COVID-19. After COVID-19, India shifted from, especially where we used to import from 80% of surgical consumables, biomedical, everything imported. Today we have become self-reliant up to 85% in especially in surgical consumables, non-consumables, biomedical equipments, all equipments. Only 15% big equipments we import from other countries. Next one is, I mentioned that one word called as Ghaziabad. There is one relationship called as Ghaziabad and India. Ghaziabad is where, anybody knows Ghaziabad, where it is? Where is So Lezama is, which is very about 60 kilometers near to Delhi. Here, we have got our very big office of pharmacovigilance office, which is manned by Indian Pharmacopoeia Commission. Okay, where all the cases, all of you who are working in hospital sector, industry sector, all your PPPNs, pharmacovigilance, okay, everything is recorded, monitored, and there is a body which is sitting, a special body which is monitoring here from Ghaziabad. Okay, next one is when it comes to hospital sector, what are the current role? Current role, what do in hospitals? All medical pharmacists, my dear students, they are all trained in hospital sector. What do you do in hospital? Yes, Hindu, what do you do in hospital? You have been training us in last 1 year. So last 1 year, you have been trained in hospital. In hospital, what do you do? Mainly you go for ward round, take a case sheet, then write in any kind of medication errors, or you also do intervention, medication chart review and interventions. Okay, but most of it is only theoretical. Practically, interventions are not yet happening. Okay, next one is in AIDS. We have got one of our teacher who has done PhD in AIDS. Dr. Vivek sir, he has done PhD from AIDS. So you should throw light on this. For everyone, AIDS was the first hospital in India to implement for every 50 beds one pharmacist, followed by CMC Vellore. CMC Vellore is the first hospital in India to have a clinical pharmacology department. Clinical pharmacology department. The first HOD was, head of the department was Dr. Hemnaini was the first HOD, was in clinical pharmacology. So as from Tamil Nadu, we should be very proud of CMC Vellore. CMC Vellore has contributed to the country the first clinical pharmacology department, headed by Dr. Hemnaini. Okay, he was the first doctor of clinical pharmacology department. Then subsequently, we have AIDS. Then all DIPMAs, okay, all DIPMAs implemented, all government institutions implemented. Now coming to community pharmacy is dispensing the medicines. You can see the difference in hospital as well as community. In hospital, you will see dispensing of medicines plus clinical services. Whereas in community pharmacy, which are mostly in rural areas, you will see only dispensing of medicines. Dispensing means Vanga, Eduthukonga, Ponga. Vanga, Eduthukonga, Ponga. That means, come sir, you prescribe the medicines as per the prescription, Vanga. Eduthukonga. That means you will dispense the medicines. All left pharmacists were smiling. Okay, Vanga, Eduthukonga, Ponga. Okay, so you take the prescription, you dispense the medications, as well as you educate the patient on how to take and what to take, and Ponga. Then smile on his face. Next one is OTC brands. What are OTC brands? Over-the-counter brands. So, Government of India, they allow the pharmacists to prescribe drugs. Allow the pharmacists to prescribe drugs. I think all of you are aware, Government of India and Drug Controlling Authority of India has allowed the pharmacists to prescribe the drugs for minor elements. For minor elements. What are the minor elements? They are cough, cold, fever, pain, okay, motions. You might be seeing in Tamil Nadu, I don't know. In Tamil Nadu, I think we headache for we gas some people are asked, we headache for that. ಜಾಸ್ತಿ ಆಗುತ್ತಾ ಮಾತ್ರ ಎದಕ್ಕೆ ಕೊಡುದಿಲ್ಲ ಜಾಸ್ತಿ ಆದ್ರೂ ಕೊಡುದಿಲ್ಲ ಕಮ್ಮಿ ಆದ್ರೂ ಕೊಡುದಿಲ್ಲ ಎದಕ್ಕೆ ಕೊಡುದಿಲ್ಲ ಕಮ್ಮಿ ಆಗುತ್ತೆ ಜಾಸ್ತಿ ಆಗುತ್ತೆ so in the same way motions also illiterate people from villages they put their way of expression expression in their own language all this they put all their way of expression in expressing their form of pain, where the pharmacist's responsibility to understand the patient. Suppose he is asking, to reduce the headache. Or sometimes negative diarrhea will come. Diarrhea mark. Suddenly a patient will come, ask direct mark. ಜಾಸ್ತಿ ಆಗುತ್ತಾ ಕಮ್ಮಿ ಆಗುತ್ತಾ? As pharmacist, the patient will come and ask you, give me tablet for diarrhea. You have to increase or decrease. So you have to be smart enough to understand the patient need. There comes your role to interact with the patient, whether to increase or to decrease. Okay. Some people will also have the problem of diarrhea. They are not getting motions. Diarrhea of diarrhea out. That means for inducing diarrhea, please give me tablets. And the Madri, current industry is there. Okay. Therefore, as a pharmacist, you have to be silence please, large speeches, lots of all LLPs, lots of large speeches, please listen. Enjoy this human. Okay. Otherwise, you will become diarrhea increases, not diarrhea reduces. You will become pharmacist to increase the diarrhea of the patient, not reduce the diarrhea of the patient. And do you want to increase the diarrhea of the patient? Yes or no? You want to increase the diarrhea of the patient? Answer, all of you answer. You want to increase the diarrhea of the patient? No. Then pay attention. So that way, community pharmacy is dispensing the medicine. So the pharmacist is allowed to prescribe medicines for minor ailments. Like how a doctor is authorized to prescribe medicines for minor ailments, medium ailments, and major ailments and critical diseases. In that we have got a small share in prescribing a drug, and that is for minor ailments. Clear? For minor ailments. And also what has happened, Government of India has also given permission for OTC drugs. OTC drugs also will be available over the counter drugs. They will have the same combination like other drugs also which are used for prescriptions. But a question may come in your mind, why the Government of India has allowed OTC drugs for prescription drugs? Prescription drugs are given in high doses. Prescription drugs for the same OTC drugs are given in high doses, whereas over-the-counter drugs are given in low doses. They are given in low doses. That means Government of India for common ailments and minor ailments, whichever the drugs are in fast usage, okay, they want to reduce the interface with the doctor. They want to reduce the interface with the doctor and protect the poor patient pocket from burning the money. Therefore, what they have done to bridge that gap, they have authorized the pharmacists to prescribe drugs for minor ailments. That is the way how minor ailments in low doses, not in high doses. So when the doses are low, then only Government of India is allowed for OTC drugs. Here, all of you. Next one is industry. Okay, industry, all of you know is production. All of you know production, quality control, quality assurance. Okay. Apart from that, next one is regulatory affairs. Regulatory affairs is one of the most burgeoning course. Burgeoning is one of the most happening course in the industry. Regulatory affairs. One of the most happening course in India today. For next, this will live for another 5 to 6 years. Regulatory affairs will go very strongly. Next one is PV, pharmacovigilance. We are upgrading ourselves. When you compare with abroad, when I was working abroad, where pharmacists are allowed to prescribe drugs for major ailments. When a pharmacist comments, when he goes for board rounds, and when they say there are many drug monitoring or medication chart review, when pharmacists recommend something, the doctor is very serious. Doctor is very serious and he will act immediately on the advice of the pharmacist. Okay, doctor, what happens nowadays between various departments, there is one new word called as EHR. What is EHR? That is called as electronic health records. That means doctor who is diagnosing the disease is feeding everything into the system. The feeding into the system, whether it is outpatient pharmacy or inpatient pharmacy or patient in the ward. When he is prescribing the diagnosis, everything, the same thing immediately in abroad will be visible in the monitor of the clinical pharmacist. Under each clinical pharmacologist or pharmacist, there will be 4 clinical pharmacists who will be assisting the head, the chief clinical pharmacist. Okay, so this clinical pharmacist, the team, immediately when the electronic health records are coming, they will scrutinize. They will scrutinize the drugs by using electronic softwares. By using electronic softwares in abroad, they use a lot of electronic softwares. Okay. Apart from this, if they got any doubt, if something is not matching in the electronic software, they go for primary sources. What is primary source information? Primary source is from final year students. Do you know primary source information from primary sources? Trishul and Gaudi Kumar, you know what? Do you know about the information? What is primary sources? On the first year, anyone know primary sources? Primary sources is information from leading journals like New England Journal of Medicine, American Heart Association, Indian Journal of Pharmacology, whether the information is taken. Suppose you are not getting any information, that means when the prescription of the doctor is coming with the diagnosis, what do you do? In the electronic report, they try to verify everything. If it is not reflecting that there is any doubt, they go back and check to the books. That is first thing they go is primary sources of reputed journals, then secondary sources, okay, which will authenticate the primary sources, and the third one is other sources, that is from books. This is the way how the sequence goes on. Okay, abroad. But this has not yet come to India. But in India, what is happening? Only in India we have got only drug information centers. We have got drug information centers and poison information centers. Whenever a doctor will get any query, doctor will raise a query, and now that query will be sent to the drug information center. Drug information center will record the query. Will record what is the query, who is the patient, what is the age, what is the diagnosis. Everything will return that query, and that query will be sourced out from first is electronic health records. Otherwise, we also refer back to the doctors. That is primary sources, secondary sources, and tertiary sources. This is the way how the drug information center, especially RA, that is regulatory affairs and PP. Okay, and CDSO, Central Drug Organization, is very active on PPPI as well as in IBC. So next one is coming is regulatory. The people who are working in regulatory, they have got a lot of opportunities to become drugs inspectors. To write drug inspectors. That means if you do MPharm, if you are doing MPharm regulatory, or you are working in regulatory affairs or regulatory department, your chances of getting drug inspector or writing exam for drug department is very high. No doubt other departments are there, but your chances are better because most of the drug department work what they do is regulatory. That is law enforcement, which is done by actually Drug Control Laboratory of India. Next one, coming to academics, and also in India there are 6,500 plus posts for state FDA under state FDA Food and Drug Administration for drug inspectors, okay, which is very less in India. Our population has increased. These are all 1980 figures, but we are in 2026. It should have become 60,000 to 1 lakh drug inspectors across country. But nowadays they only take hardly about 10,000 drug inspectors across the country. Okay, which is very less for us. When you come to academic, first there was DPharm, then came BPharm, then came MPharm, then came PharmD. Okay. Now further in MPharm also, we had only first one was Cognosy, followed by pharmacology, then pharmaceutics. One is Cognosy for drugs, okay, that is study of proved drugs. We had then pharmaceutics for manufacturing, the pharmacology for research, and so on. Now what happened? Regulatory has come, and further more and more courses as per the industry requirement. Government of India, in consultation with Commerce Council of India, or based on the recommendations of Commerce Council of India, they are framing new courses based on the skills which are required for the industry. That is, industry-specific, skill-based post-graduation programs are going to emerge. That is going to be the future prospect of the future prospect of the industry of academics. Next slide. The current role, industry, all of you know, I don't go very details. There is quality assurance, apart from production, quality assurance, quality control, regulatory and PV. What is PV? PV is not only Vijay. PV is not Vijay. Commonly students, what is PV? What is PV? PV is pharmacovigilance. Next one is CDSO. CDSO. Okay, apart from their role, CDSO will control all the government pharmacies as well as drug inspectors. We have got Indian Pharmacopoeia Commission, which is controlling. Indian Pharmacopoeia Commission which is controlling. We have got members, Dr. Shivkumar, Dr. Vijay Kumar, all the members of Indian Pharmacopoeia Commission. They are the most valuable people. Whenever you want any knowledge, you can go to them and learn from them. Shivkumar sir and Vijay Kumar sir. They are all the members of Indian Pharmacopoeia Commission. We are very proud of. Give them a big clap for them. Big clap for Shivkumar sir. Next one is IPC. So IPC is controlling Indian pharmacovigilance. Do you know? I would like to ask some questions straight to final year pharmacy, B.Pharm final year students, M.Pharm pharmacology students. You all are aspiring to become. You want to go your career to pharmacovigilance department. When I ask somebody, when I interact with during my interaction, I find, sir, I want to go to pharmacovigilance. I want to do medical coding. I want to do that. I want to do this. But do you know that Indian Pharmacopoeia Commission is conducting a program, 6 months training program, where they will give a certificate for you on pharmacovigilance. They will train you. Do you know what is the fees for 6 months? The fees is only 10,000 rupees. There is 1 month course, 2 months course, 3 months course, and 6 months course. For 1 month course is only 2,000 rupees. For 2 months course is 4,000. For 3 months is 6,000. And for 6 months is 10,000 rupees. Tell me, all of you who are interested in pharmacovigilance, how many of you have read this? I have read this. So, jobs are there. Jobs are there. Plenty of jobs are there. Government of India is creating job opportunities. But I would impress upon each one of you, final year students as well as M.Pharm students. Put a question to yourself. Am I skilled enough to grab that opportunity in pharmacovigilance department? Am I skilled enough to grab the opportunity of pharmacovigilance or regulatory affairs? Am I skilled enough? That's what is the question. That means there is a qualification, but unfortunately, only 15% of people are employable. Only 15% of people are employable. Balance 85% of people are they have got knowledge, but they are not employable because they don't have the skill. They don't have the skill. That's why all these students who are sitting here, you have to be serious about your career. You have to be serious about your career. For third year students, if you are planning to go to next year, think this very seriously. As well as PharmD students also, you should think very seriously of about pharmacovigilance of getting certified from Indian Pharmacopoeia Commission, which is a valid certificate. They will train you in Madras, in Chennai, in MMC. MMC, they'll give you 6 months training. Okay? They'll give 1 month training, 2 months training, 3 months training, 6 months training. Where you can look into this opportunity. Okay? Next. The regulated question which is expanding scope is, that is, as per Pharmacy Act 1948, for millennials like us, especially we were only pharmacy dispensing. But now they are proposing pharmacies prescribing for minor ailments which will already come into existence. Next one is National Digital Health Machine. They are giving e-prescriptions need to be monitored by a pharmacist. That means you may all of you might see Tata 1mg, all MedPlus also they have come with online, everything. Apollo online. You take namely pharmacy, they have got all online. They are encouraging online. But one good thing is that the number of online companies or online companies which are increasing will increase. What is happening? Doctor. So the number of opportunities for pharmacists also are increasing proportionately. Therefore, it is very, very important for us. So anything online, it has to be verified by a pharmacist. Okay. So at the same time, as per the new rules, that is new drug clinical trials, that is NDCP rules for 2019. What they have done, the police they have appointed, but also they want a pharmacovigilance qualified person. Okay, pharmacovigilance qualified person. Next one, as per LEM, also in the LEM National List of Essential Medicines, earlier it was major role was from industry. There was from industry as well as from doctors. But nowadays, one of the key member is pharmacist. One of the key member is pharmacist. In formulary also, who is the key member? The key member will be the general secretary, will be the pharmacist. We will take decisions on national list of essential medicines. So be proud of that. Next one. So here, what is the emerging field? In emerging field, we have digital and tech telepharmacy. Digital and tech telepharmacy. All of you might be thinking, what is digital pharmacy? What is telepharmacy? All telepharmacies are handled by whom? Handled by pharmacists. You have big clap for that. This is a new generation pharmacist. Earlier the doctors used to handle telepharmacy. Now all the telepharmacists under the new government scheme called as E-Sanjeevani OPD Council for Pharmacists. Okay, there is a scheme called as E-Sanjeevani, which has been introduced by Government of India. Okay, why do you use the name E-Sanjeevani? Can anybody answer this question? Why Government of India has used the name E-Sanjeevani? Did you hear this word Sanjeevani anywhere? Sanjeevani, did you hear? Anybody from final year? All final year you are going to become Sanjeevanis. You are going to become Sanjeevanis once you complete course. Tell me, anybody here counting? Why Sanjeevani? Did you hear the word Sanjeevani? No. Do you know Ramayana? I'm just asking her. Otherwise, the other side. How many of you know Ramayana? Vijay, Berlin? You know Ramayana? Sandra, you know Ramayana? Here, front side, how many of you know Ramayana? Kirtika, do you know Ramayana? In Ramayana, when Lord Ram and Lakshman was hurt. Okay, when Lord Ram also was hurt, that Lakshman was seriously injured. What happens? Okay, he was completely unconscious. He was in bad situation. That time, what happened? Okay, Lord Hanuman. Some direction was given to Lord Hanuman, where he fly down to Sanjeevani Mountain. Sanjeevani Mountain, miles away, where he brought a Sanjeevani plant and where Lord Lakshman was cured. That's why, that means it is in a Sanjeevani is in a distance. So telepharmacy. Nowadays we cannot play. As a pharmacist, can you play? Who was the first pharmacist of the world? The first pharmacist of the world was Lord Hanuman. Hanuman was the first pharmacist of the world. Are you aware? I am very proud. My guru, who is my senior? My senior is Lord Hanuman. All of you clap for yourself. Our senior is Hanuman. Do you know? Lord Hanuman was the first man to fly the mountains and bring the drug from Sanjeevani mountain and give it to Lord Lakshman. So what is our job? We also medicines. So in the same way, in distant places, silence please. In distant places where people or forest people or in remote places or in tribes, Where they cannot come to the metros or they do not know what happens. Government of India has facilitated the clinical pharmacies, all the pharmacies to handle the department known as digital and tech technology or telepharmacy under the new scheme called as e-certificate. So all of us should be proud of that. All of us should be very, very proud of this scheme because we all will get opportunities as telepharmacists also to handle these drugs directly. Be proud of that. Give a big clap for you, for yourself. All of you clap loudly for yourself. Next one is artificial intelligence. AI is equal to MI. What is AI? MI? What is MI? Anybody know about MI? You all know, you are all part of MI. You are all part of MI. Half knowledge of AI is called as MI. Half knowledge of AI is called as MI. MI means monkey intelligence. Those who have got half knowledge of AI will become MI. That is called as monkey intelligence. Okay. So in order to that, going forward, but already AI has taken over all the artificial intelligence. In abroad, it has already come. It has already started full-fledged with hospitals. That is, all the drug interactions of the prescription. In the electronic health records, when it comes to the pharmacist will press the button. He uses software. The prescription will automatically is channelized. Prescription is automatically channelized to go to the health. Will go to the automatically AI. AI will scan for the any drug interaction. When there is a drug interaction, what happens? It will pop up. It will pop up to the pharmacist that there is a problem. There is a problem. That means immediately the pharmacist, the clinical pharmacist, whatever is popping up, immediately you will take that in, you will check that in, attend, and revert back to the doctor. Doctor, what you are recommending is part of drug interaction. Can you look to the change it? Can you change it? This is already come in Singapore. When I am working in Singapore, it is already there in Japan. It is already there in Malaysia. It is already there in Philippines. Okay, it is all there in these countries. It is already there. There in practice, AI in drug interactions. So this way, it is also going to come to India also going forward. So for all BPharm students, all MPharm students, all PharmD students, as and when you get opportunity during your course of your journey of your education of 6 years, 4 years, okay, 2 years, or whatever as long as you are there, try to acquire an additional qualification of AI certification. AI certification. Just a normal basic course is sufficient. You do not do a PhD in AI, no, not required. For us, we want basic course in AI. 1 month course or 2 months course, on Saturdays, Sundays, whenever you get holidays, Sundays, you can try to improve your knowledge and get the certification. That will what happens if you are when you are putting in your resume, pharmacovigilance certificate from Indian Pharmacopoeia. Next one is if you are putting on the AI certification, for you will be getting the job first immediately. I can challenge you that the people who are getting certification in PUPI as well as who are getting certificate in AI will be the first people who will be grabbing the opportunity with a better salary. What is the average salary of the industry? The average salary of the industry nowadays for all the pharmacists who are production, they pay only 15,000 to 18,000 rupees. 15,000 to 18,000 rupees is the average salary they pay. Okay, right? So in that case, if you are AI based, if you are AI certified or PUPA certified, your salary will directly jump to 25 to 30,000 rupees. Directly jump to 25 to 30,000 rupees. That's why you have to be. You enjoy the course. I'm not telling you enjoy it. Come to the college, enjoy it. But what is important is that your career focus, along with your studies and enjoyment, also is extremely important for you to define your career ahead. That means what you do today, the seed you sow today, will reap the fruits later. That means your fruits of hard labor, what you are going to do today will define your career tomorrow. Will define your career tomorrow. Today you enjoy only don't do anything. Tomorrow you are going to struggle. You will be a struggler. Okay. Next one is blockchain. Now, for example, in pharmacies or companies, what they do, any low quality drug, okay, that is track and trace for not a shared quality drugs. Now robots, they have installed robots. You can see here, a robot being installed in the picture here. A robot will pick up the drug. In that, the entire data, artificial intelligence data is spread. You scan the product and give the content everything. It gives the quality, content, everything in that. That way, the robots are come to the picture. This is available in Apollo. Apollo they are experimenting, and they are also experimenting in Vedanta. Very safely in India. Robots are doing this job. And also, there are robot dispensing. When the prescription is going automatically, the robots are dispensing the medicines. But ultimately, before handing over the prescription to the concerned patient, the pharmacist will check. Let 10,000 robots come. Nobody can replace the job of a pharmacist. Why? No robot can replace the job of a pharmacist. Because pharmacist values the human life. Okay. Next one. So what is the emerging roles in clinical pharmacy? The emerging role in clinical pharmacy is medication therapy management, that is discharge counseling, cuts remission, that is readmission by almost 20%. A study was conducted in Max Hospital. This is one of the study conducted. That means when a patient is being discharged, he is counseled by a clinical pharmacologist or the pharmacist. The readmission chances fall by 20%. 20% means it is a very good success rate. Okay. Next one is PDM services. What do you mean by therapeutic drug monitoring? Therapeutic drug monitoring. For example, a patient whom you are giving vancomycin, you are giving cancer drugs, you are giving aminoglycoside injections. Okay, for all critical antibacterials and antibiotics. What happens is here, the antibiotics, all the critical antibiotics are given on per kg body weight dosage calculation. Per kg body weight dosage calculation. So based on the per kg body weight dosage calculation, whatever is given, same thing, there will be a half-life. All of you know half-life? Anybody what is half-life? Anybody what is half-life? Anybody? Half-life. What is half-life? What is half-life? Reducing the life by half is called half-life. The time taken for the drug to reduce its half of its initial concentration is called as half-life. Okay. So, for example, that particular half-life is there. When the peak half-life of that particular drug, what they do, the concerned, that is B.Pharm student who is trained in PI or pharm-based students who are going to handle this in future, they are also going to do therapeutic drug monitoring, especially in specialty clinics like oncology, endocrinology, okay, neurology, neuropsychiatry, gastroenterology, orthopedics, all the super specialties. Going forward, they are going to do therapeutic drug monitoring. But in India, therapeutic drug monitoring as a mandatory role is being done in KM Hospital, Bombay, and as well as done in All India Institute of Medical Sciences, Delhi, and Chipman Pondicherry also has just started, and PGH Chandigarh. All the government institutes they have started. But in KM Hospital also in Bombay, they are doing it on a regular basis. And one more hospital is doing on a regular basis is Tata Cancer Hospital. And next one is antimicrobial stewardship. Antimicrobial stewardship is one of the biggest areas where India is number one. India is number one in drug abuse. Drug abuse means the highest antibiotics which are recommended in the world are in India. Misuse, abuse, misuse, okay, wrong use. Even for small element also they are recommending high antibiotics because the drug development has go like a magic. The patient has to recover faster. What has happened? That's why as of yesterday only I think the highest recommended was amoxicillin. It is amoxicillin 2 mg and clavulanic acid 120 tablets have been banned by government of India for children. Are you aware? There are 16 drugs which have been banned by government of India yesterday. That is called fixed dose combination because of the misuse and abuse. And also what is happening? There is a drug resistance in the children. Therefore, government of India now they have admitted. So in such kind of condition, what do you do? There is a word specific word called as antimicrobial stewardship. This antimicrobial stewardship, before implementing any major antibiotic, what happens? The pharmacist is taken into the loop along with the doctor and the microbiologist. They form a team. That is the pharmacist, the microbiologist, and the doctor. What they do? They withdraw the blood samples from the particular patient, okay, and then they do culture sensitivity, and based on that they calculate the MIC, okay, the MIC values and everything, and then accordingly they give the antibiotic to the patient. So this has been done selectively in few hospitals in India, but not everywhere. Okay. Next one is ICMR mandate. In ICMR mandate also there is a mandate. One biggest thing in CMC when they achieved was they have reduced the target limit. In critical illness, the drug which was used as verapinum, carbamazepine, which are used very left, right, center by the doctors. Okay, which they caught government of India during the audit. They caught why they are using so much verapinum, why they are using so much itrapinum, why they are using carbamazepine. When they caught, they found out that the doctors want the patient to recover faster. But the doctor is doing injustice to the patient because the patient has developed a drug resistance. He has developed a multi-drug resistance. Ultimately, no drug will work on the patient. So therefore, in order to do that, they have formed is a mandate that compulsory antimicrobial stewardship, which is also new area where all of you will get lot of job opportunities. Okay. Next one is pharmacovigilance. In pharmacovigilance, we have got 700 AMC centers in India. 700 AMC centers in India. What is AMC centers? That is Adverse Drug Reaction Monitoring Centers. How many centers we have? 700 centers. In these 700 centers, they have employed 1,250 pharmacovigilance qualified certified people. Pharmacovigilance certified qualified people they have employed. Where it is very big, where the salary is very good for them. So, if you also do the PVPI certification course, your job opportunity also will be much better. You get a better opportunity. If you want any details, you can go to press in the Google. Okay, all of you are well versed in Google Baba. Okay, who is our God? Nowadays, Google is our God of knowledge. Not Manmantri. Okay, so in Google Baba, or Google Namas, all of you know about Google Baba and Google Namas. Go to Google, press Indian Pharmacopoeia Commission and press PVPA courses. Then you will get it. For one full year, you will get which days they are conducting the exam or which days they are conducting the courses. You can choose of your choice. That is Indian Pharmacopoeia Commission PVPA courses. Okay. Next one is poison information in AIIMS Kochi. All names from better sexes. That is all names from Kochi, Delhi, 24/7. Poison information center is monitored by the PharmD students. It's monitored by the PharmD students because they also, the PharmD students apart from that, they also go into medical management. They also do the medical management. Because of that, they allow PharmD students to 24/7 to handle the poison information centers. Because they can do also do the gastric lavage. When you are going for 6th year, they are not allowed that, but they are trained in that. Okay. Only today PharmD students, you don't touch the body of the patient. But once you are trained in that, you are being empowered to do anything. That means gastric lavage, everything you are trained to give injection, to do everything you will be trained. Your pharmacy students also are trained to give injection. I don't know how many become final students know how to give injection. Pushpalata, Hindu, you know how to give injection? Final students, boys, Roshan, Praveen, you know how to give injection? Don't know. You are not trained? In hospital you should be trained. You should know how to give injection. You should get trained. Okay. D-Farm student will give injection. D-Farm. D-Farm. You are B-Farm. You are B-Farm, you are PharmD. You don't need injection. Okay. Next, in CMC Vellore, when they followed this, they have come the length of stay was reduced by 1.3, which was related to drug-related problems. Okay, so CMC Vellore indirectly is a correlate for many. Is a correlate. All of you understand correlate means which is leading from front. CMC Vellore is leading from front for many hospitals in India. Next slide. The specialized clinic now going forward, the new opportunities, the new job opportunities which are emerging very clearly is oncology pharmacists, geriatric pharmacists, NSU, that is neonatal ICU pharmacists, like in operation theatre, for example, in nurses, all of you know nurses, operation theatre technician, general surgery technician, operation theatre, CT technician, variety. For each specialty, you are going to get opportunities in jobs. If you are going to the specialty, your salary will just be doubled. Outside, if you are going as a pharmacist at 15,000 or 18,000, if you are going to this, you are going to get your salary will be 25,000 to 30,000 rupees. You are going to get in a specialty pharmacist. Okay, that is the advantage of new emerging opportunities in India. Next one is NSU. Why NSU? In geriatric pharmacy also is a new area because in India by 2050, 14 crores is a low figure. Actually, about 21 crores are going to become geriatric population. In that, I mentioned one word called as Beers criteria. Boys, not the beer which you drink, not that criteria. Not the beer which you drink, not the beer which you drink. That is not called the Beers criteria. Beers criteria is a medical synonym which is used for identifying the polypharmacy. The polypharmacy which are appropriate, non-appropriate drugs. That means in all the geriatric patients who are hospitalized in hospital, there is a polypharmacy where they are recommending more than 5 to 6 drugs. There, a new concept has evolved in monitoring that is called as Beers criteria. What criteria? Beers criteria. Drug, not this. Okay? All of you. Next one is nuclear pharmacy. One more which is one of the most, I think most of you girls will like is called as neonatal pharmacist. Neonatal pharmacist is that you will be taking taking care of the babies. In NSU, only babies. In babies also, all the drugs are given on per kg body weight calculation. So who will do the calculation? The calculation is done by the pharmacist. Like going forward, okay, like how a doctor specialty also, oncologist, geriatric specialist, neonatologist, the same way pharmacy profession also is evolving into neonatal pharmacist, neonatology pharmacist, that is NSU pharmacist, oncology pharmacist, geriatric pharmacist. It is going to get specialized. Okay. Next one is nuclear pharmacy. Next time ask you nuclear pharmacy. Nuclear pharmacy is one area which is growing very rampant in India. Okay. Wherever there is a PET scan, CT scan, MRI scan, okay, all cancer centers, they are appointing nuclear pharmacists. The nuclear pharmacist salary will be above 50,000 rupees. Above 50,000 rupees. Okay. This is one area where, in case you are getting opportunity, please grab the opportunity. Okay. So, what are the pharmacists do? Nuclear pharmacy. In nuclear pharmacy, they prepare, for example, PET scan. And all these are not monitored by Pharmacy Council of India. They are monitored by Atomic Energy Regulatory Bodies. It is called as BARC, Bombay Atomic Research Center. All of you know Bombay Atomic Research Center. That means, for example, somebody is appointed as a PET pharmacist. They have one hospital has purchased a PET scan. Compulsory, they should have a nuclear pharmacy department. Because why? What is PET scan? PET scan is positron emission tomography. That means positron emission of tomography that is causing radiation. That radiation measuring will be done by the pharmacist and then give the dosage to the pharmacist. Okay. That is about nuclear next. Next slide. In public health and primary care, prescribing rights. For the first time in India, Kerala, they have started a pilot project. Government of India started a pilot project in Kerala, where the pharmacists can prescribe anti-hypertensive drugs as well as anti-diabetic drugs. A pilot project that just started in Kerala, Kochi, okay, which is going very well. All of you, first pilot project is started in Kerala. Prescribing rights going very well. Next one is vaccination. Pharmacist as a immunizer. Vaccination. Next one is AMR. That is antibiotic resistance. Pharmacist has AMS lead. Next slide. Next one is pharmacogenomics, which is specifically based for HLA-B 1502. That is just for diagnosis to prevent Stevens-Johnson syndrome. That means before you recommend any kind of critical drugs, pharmacogenomics will come into picture. Next one is health economics and outcomes research. That is also going on. And one of my topic is pharmacoeconomics, which I am doing PhD on. That is HEOR. That is health economics and outcomes. I am doing PhD on this topic. Okay. That is cost effectiveness studies. Next one is 3D printing. 3D printing also has coming into the existence. That is personalized tablets to the people as well as predicted dosage. Next one is biologics and biosimilars. That is pharmacists in cold chain and as well as in patient predicted. What are the challenges? The challenges are we are seen only at the end of the day as a shopkeeper. One medical shop. Pharmacist means medical shop. That is our life. That paradigm shift you have to change. Okay. In India, government pharmacist is 35,000 rupees salary, whereas doctor is 65,000. There is a gap. Okay. Next one, what is the policy? There is a fight between Pharmacy Council of India as well as Medical Council of India. That means fight means they are trying to convince Medical Council of India, Pharmacy Council of India is trying to convince Medical Council of India for prescription rights for the pharmacists like abroad. For clinical pharmacologists and clinical pharmacy students. Okay. Lastly, what is the way forward? The way forward is what is the new motto? That is access, advice, advocate, not just dispense. The pharmacist of the future will not just dispense medicines. You will decide about the medicines prescribed to the patients. Okay. Lastly, to end my talk. Okay. Dedication is more important than resignation. Sincerity is more important than seniority. Sincerity is more important than seniority. And mindset is more important than marks. Okay. Success is not an escalator, but a series of steps that we require is continuous efforts. Success will come to those people who put their efforts consistently, continuously. Life is not about passing or failing, or winning or losing, but life is about value of relationships. First of all, we all are human beings and treat humanity as first priority. Om Sai Ram. Thank you so much. Any questions? Indu, you're asking some question. Yeah. Okay. What is that button? Huh? So, good evening, friends. I thank our chairperson, thank our registrar. I also thank our honorable dean, Dr. Deepa Madam. I thank all the faculties, HODs, my beloved students for giving this opportunity, especially, and also for being very disciplined today and evolving for smooth sailing to this national conference. And thank you so much. Thank you so much. Thank you everybody. Now the speaker from Mukherjee as well as Dr. Uttar Sansare was taken time to spend on the busy schedule for organizing our request for being the speaker. Thank you so much. Thank you. We'll go to your classes.